And I also wanted to let you know that I know the importance of your job. Back in 2006, which I will get into the Nile story and I'll go off script here, but I just want you to know that I have had the pleasure of working with legislative aides and staffers that have helped us implement 2 laws in the state of California that are very powerful laws. They require transparency. They require every acute care hospital to report their infection rate. How many people come into each hospital and get an infection? So I know how much work is on your backs and that many times you guys don't get credit. So my hope is today, and my goal is today, that I inspire you to learn more about the problem that the world has today of antibiotic resistance. The president made it loud and clear in 2014. It was an answer to my prayers that now our country and other nations will focus on this because it is a big problem. I urge all of you to go to Google TED Talks and look up Maren McKenna. She will give you a very quick, very appropriate discussion around what is truly happening with our antibiotics and why it is so critical that we all participate in solving this problem. So my son Niall is an example of what happens with antibiotic resistance, and I'm going to focus on prevention. The biggest issue that we have with the overuse of antibiotics and what's happened, why we're having this problem, is that in our country, our physicians, and who knows why and how this started happening, but we overprescribe. We overprescribe for things that don't even apply, and we're guessing. So how rapid testing fits into this equation is enormous. Today, there are rapid tests that are available to find out if, in an hour or 2, if someone has MRSA. That's offered by Cepheid, and they swab your nose. If you look like you have the symptoms, they should be swabbing your nose and finding out, do you have MRSA? But as I get into the story, you'll see that's not happening today. So thank you for your time and thank you for being here. I know it's a little bit longer than normal. The other thing I'm going to do is right up front is knowing that you're busy, I'm going to give you a call to action that what we need from you. And I always liked if people would state that up front, and then later on in the discussion, I'll give the justifications. But the number one thing that we need somebody in this office, somebody in legislation to work on is to require a national healthcare certification. Make it certification training, like all of us do for ethics or for security. You can do it online. You can sit at Starbucks and load it. But the problem that you touched on also is that people aren't educated, even doctors, very smart people. We need a national healthcare certification training for antibiotic resistance, for antibiotic stewardship, and for infection prevention and sepsis. We would save so many lives if people actually knew what's happening and were updated. That'll be a perfect time to update people on what's happening with rapid tests so they'll know what's available. So I need somebody to step up, and I'm happy to work with you. We have lots of people that can bring and share personal stories. Number 2, we need to have notifications in a healthcare facility when there is an outbreak happening. We experienced this with NIH. There was an outbreak happening, and people continued to be admitted. What the public needs is notification for especially the patients that are in the building and those that are coming and registering to come in the building, because we, the public, deserve this information. That's not happening today. Number 3, we need a national antibiotic drug dispensary registry, because in the Netherlands, they don't have this problem. because they're watching who is prescribing these infections, these antibiotics. So we need as a nation to have oversight of our national treasure, antibiotics, because if we don't watch this, we won't have them. And a trip to the hospital for surgery for your tonsils to be removed may be life-threatening. So in addition, and you'll see when I continue to move forward, we need to build a new group for oversight to work with CMS to enforce the CDC guidelines. A perfect example was what happened with Ebola. The hospital in Texas didn't follow the CDC guidelines. The CDC has incredible people that know what to do, but we learned that these guidelines are not the law. Every hospital can decide what are they going to do. Are they going to follow these guidelines or not? So I'd love to work with someone in here that wants to work with me and many other people to give the CDC guidelines as a requirement to do business and take care of patients in the U.S. And the last one, number 5, today we don't have a clue as to how many people are getting these antibiotic infections. We can take guesses, but if somebody gets an infection in the community, it's not going to the CDC. They're measuring hospitals. So we need to add MRSA, C. diff, CRE, MERS, and VRE infections to the National Reportable Registry so that we can finally get a baseline and see how many people actually have these infections, implement these great new processes that the CDC is coming out with, and make sure that we are doing the right thing. We can actually have a true baseline, which we don't have for out-of-patient in the community. So thank you for letting me digress to that, because I know just in case if somebody would leave, I wanted to make sure we had that. So my goal today is to inspire you to help follow up, because you are our future. You are the ones that will drive what it looks like for people in more generations. And we can fix this problem that we're having. I wanted to make sure you guys all have this little brochure, this thing that did everybody get those? This is my son, Niall, and there's some out front if you guys want to get them. But I wanted to make sure you got to know him just a little bit. So Niall was born with a few challenges at birth, but he overcame them. With great faith and perseverance, he became just an incredible young man. There's some pictures of him wearing the actual Mr. Incredible costume. He loved to dress up in costumes and ride his horse Tex. So the challenge, and we're just so thankful that we had Niall in our lives for 15 years, because we lived our life for every minute. Today he's inspiring many people just with his story. So there's never been a more urgent public health need for rapid diagnostic tools than today, as you've heard. Today, right now, is too late for a lot of people. I think that it's important for you to hear some of the numbers. So I know you hear numbers all the time, but Niall, who was 15, represents one of the 1.7 million people that go into hospitals and get these infections, these deadly antibiotic-resistant infections. And those are figures from the CDC. 1.7 million people go in every year. He's one person, one name. There's all those other people that this happens to. And you need to know they're preventable. These infections are preventable with deep environmental cleaning, with screening patients at the door like they do at the VA, not allowing people to come in that are covered in, that have bacteria, unless we put them in the proper place in an area of isolation so that you can prevent the spread and care for them and help them heal. So this is something that most people have no idea. And I've been talking about this for so many years, and every day I say, we need more awareness concerts, because, we need people to understand this. These infections are preventable. Niall died he was one of the 258,000 people that they get septic. So sepsis, that's caused from an infection in the body that people don't react to or treat quickly enough. The CDC says 1 million people a year they get sepsis, and it's all because we're not seeing the healthcare workers and the people are not really seeing all the symptoms. So when we talk about what is this that we're dealing with, these are big numbers, and they're real numbers. I'm passionate, I don't know if you can tell, but I'm very passionate about rapid testing. Niall's story is perfect for illustrating the need. My husband and my family and I lost our son Niall, who was only 15, from a hospital-acquired infection that was preventable. Niall entered the top children's hospital in Orange County, California, the top hospital, for just a day of testing. He was an outpatient. He didn't even spend the night. He just went to have an MRI, and he met with some of his doctors. A few days later, he displayed flu-like symptoms. The physician that we went to take care of Niall, the physician that treated Niall did not consider the symptoms he presented. She did not listen or look at his symptoms. He was wheezing. He had a fever. He was coughing up chocolatey-looking phlegm. And I know Dr. Bell, just hearing this, she would know right away that this is in the lungs now. And it was so unbelievable when I found out later that she knew that we'd just been in the hospital. Now, physicians should know, if somebody spends a whole day in the hospital, there's hospital-acquired infections in there, we better test. But they didn't test. So what was so strange to me was that she knew he had just spent some time in an MRI. She could see that Niall had a fever. He was wheezing. He had a headache. All the symptoms of, wow, this kind of sounds like he could be septic. This is an infection going on in your body. So Niall was tested for strep throat. That resulted in a negative test. I was handed a prescription for strep throat and then they gave me the instructions to go get it filled, even though the strep test was negative. My last hour in public with my son was spent in line at Rite Aid, the pharmacy, holding him and watching him labor and wheezing and labor to breathe while I was waiting and waiting and waiting in a line for a prescription that was useless. That morning of the 16th of April, we rushed to get help for Niall. After many delays, hours and hours and hours, Niall was finally admitted to the hospital, the second children's hospital, with necrotizing pneumonia. He couldn't breathe. They only gave him antibiotics. They only gave him oxygen. And I'm going, can't you give him anything else? This is hours and hours and hours. No one was moving fast. I'm trying to get them. What else can you give him? What else can you give him? No one took his symptoms seriously. This is why the training, the certification is so critical. He did not receive a single drop of antibiotics for over 5 hours. And when they tried to give it to him, his veins were locked up. They couldn't give him any antibiotics. It was too late. He died. Rapid tests became my passion. I can remember the phone call that came to me. It was the ER physician that called to tell me that Niall's test results had come in. They had taken blood from Niall 10 hours after he was admitted to the hospital with necrotizing pneumonia. This is so ridiculous. This was 4 hours before he died. That's when they decided to take a test. Then I hung up the phone, and they had told me that he had MRSA, methicillin-resistant Staphylococcus aureus. That's a staph infection that's resistant to all the penicillins. I couldn't even spell it. I put it into Google, And all of a sudden what pops up is two things. Cepheid rapid test for MRSA, digging 2-hour response time. It was available online. People could use that. And the other was the Stop Hospital Infection campaign by the Consumer Reports people, their policy arm, which I work very closely with. The rapid test existed, and all it required was a nose swab. And within 2 hours, they could have come up with the diagnosis, and they could have given him vancomycin that could have saved his life. This was the first time I realized that hospitals don't have to provide the best care and the best tools. It's their choice. So why wouldn't the Children's Hospital, the pillar of the community, and this is the second one, use the best tools they are using today and were using then, third world country technologies that are harming patients just like my son? So methicillin-resistant staphylococcus, spelled out, is contracted in the first hospital that Niall went into because of unclean surfaces, because of simply someone not doing their job. One of the antibiotic-resistant diseases that are highly contagious, spreading through U.S. hospitals in our communities. You can contract MRSA from an unclean surface and equipment and devices, like what's been happening with the scopes for the people that are contracting CRE. You can contract it from a healthcare worker or someone not washing their hands. You can have a hug or a handshake. You can be on a playground or at a gym, and you can contract these infections. We need to get the public involved in what is really happening. The CDC reported that more than 2 million people go into these hospitals and get these infections, and these infections are preventable. In 2003, SHEA, the experts in infection control epidemiology, put out a paper that said hospitals and experts have known how to prevent these infections for 30 years. This was in 2003. They knew how to prevent these infections, but few hospitals have implemented the rapid test screening like the VA does, the deep environmental cleaning, the antibiotic stewardship, and the terminal cleaning. These are just cleaning. Our hospitals are paying their cleaning crew about $7.65 an hour when they need to be hiring professionals. This is at a point where deep environmental cleaning is critical to our lives and safety. This report bothered me because I couldn't believe that they could choose to do this. So this is why it's important that we make the CDC guidelines the law of the land, because we are at a point where a physician can deny a patient something. For example, we get calls a lot from the public saying, can you find someplace where I can get tested for MRSA? My physician won't test me. And I said, what? No, the physician will not test me. I'm working in a nursing home, but I want to go do daycare, but I'm afraid I'm colonized. This is happening in real life. You can't just go ask your doctor for a test. They won't give it to you. A woman walked up to me at an event one time, and she was a physician from another state. And she said, I want to tell you that it's dangerous to be a physician in California. I moved my family from the Midwest to Newport Beach, to a really affluent hospital. And when I got into the practice, all these people kept coming in with MRSA symptoms. So I started testing them, and they had MRSA. And I was reprimanded by my boss, who said, we don't do that here. What are you doing? We don't test for MRSA here. These are the points I want to bring up because it is critical that we start including the public as a major part of their health care. Today, I can get a home drug test a urinary tract infection test on a dipstick, a pregnancy test on a dipstick, and I can even tell when I'm ovulating on a dipstick for $1. It is clear that the public has not been brought into the equation on saving their lives. This is the time, and you are the people that we need to count on to bring this into the discussion, because you're going to hear it more and more. Pay for performance and the great things that the CMS is doing now. They are adding MRSA and C. diff to their already pay for performance topics like they're doing today. So next year, this is a big deal. Next year, we're so thankful that in 2017, hospitals will be penalized for patients contracting MRSA and C. diff in their hospitals. But my concern is children's hospitals are omitted from these safety regulations. So that's one more thing I'd love to work with someone in here on, is how do we start to protect the children's hospitals from C. diff and from MRSA, because they're not covered under the regulatory story on there. So I think that what is really critical at this point is that I want all of you to know that, we worked on a law in 2007, and that's when I had mentioned earlier. We were able to put 2 laws in place that require hospitals to report their infection rate. And that's been going on. The full law has been implemented for about 6 years now. And each year, the number of people who go into hospitals in just California and get infections, and only the ones that spend the night, are 18,000 people go into California hospitals every year and get these infections. We don't know if they died. We don't know if they're walking around with no feet and no hands like someone I know. We need to get on this, because what amazed me this year was now in California, the numbers were just published, 19,200 people went into California hospitals and were infected or have died. And not one of these hospitals have been fined or reprimanded by the Department of Health in California. And I'm on the HAI Advisory Committee for the state of California. And I can tell you that this is happening in every state. These hospitals are not implementing the tools, and they're not protecting all of us. So I am so grateful that you're here today, and I'm really hopeful that we can work together on some things, because I have hope for this nation, and I know with a will like ours, we can fix our healthcare system, which is made up of really great people that are living in situations that they've lost their soul because they see this harm happening, and they go home every night and they have to live with it. So it's really the board of directors in these hospitals that we have to start educating, because they need to know that they need to give all of their healthcare workers the tools they need to take care of us. I do this in honor of Nile and the millions of people that have been affected by preventable infections, and I thank you for your time.